Hospital Innovations, which is a regional center investment with expedited approvals. And here to chat about it, I have Dr. John Johnson and Bernie Albertini and Steve Smith. Well, to introduce Dr. Johnson, he's the CEO and owner of East Ohio Regional Hospital, which is the hospital in this particular case. In addition to being a board-certified psychiatrist, Dr. Johnson owns various healthcare organizations focused on mental health and substance abuse, including a psychiatric hospital called Access Ohio. It's great to have you here, Dr. Johnson. And Bernie Albertini is the CEO of East Ohio Regional Hospital. He has over 30 years experience in healthcare and administration. And Steve Smith has joined us as well. He's the president of EB5 Coast to Coast. He operates the regional center that's responsible for monitoring this investment. And Steve has over 10 years experience in the industry and owns and operates various regional centers. So maybe just a brief disclaimer on this particular investment as well that I won't read. But just to kick it off, maybe just some brief highlights that I can run through on Hospital Innovations before I hand over to Dr. Johnson. So this is an investment into East Ohio Regional Hospital in Martins Ferry, Ohio. As you can see from the picture on the right, this is a fully operational hospital, fully financed as well with funding from the state of Ohio. It is, in fact, in a high unemployment TEA, so qualifies for the $800,000 investment amount and a set-aside visa that Robert just described. Existing investors in this particular project have been expedited. This was previously structured as a pooled direct investment. We had 14 investors file under the pooled direct program, which is no longer available. But at last count, I think about a dozen of them have been approved for expedited processing. And the reason they were approved for expedited processing in this case is because the hospital is adding a behavioral treatment center to treat patients with opioid addiction. And Ohio obviously is sort of in the epicenter of the opioid crisis. But more on that later. Job creation's already been met. In this case, over 1,200 jobs have been created. This is structured as preferred equity offering with an escalating dividend payment. There is significant owner equity in this business. Dr. Johnson has put in over $50 million of his own capital into the hospital, acquiring the hospital, renovating it and running it. And he will maintain a significant equity stake. There are 40 slots available in this particular investment, and we are accepting fully refundable deposits to reserve a slot while you work on your source of funds. So here are some of the expedite approvals that were received, all in March, April timeframe. These investors filed around that timeframe as well. And with that, I'd like to sort of hand over to Steve maybe to introduce himself and discuss the regional center.
Thank you, Carl. Yes, so as Carl mentioned, I have been in the EB5 space for about 10 years. I've been a real estate developer for over 35 years. And in our 10-year history in EB5, we have sponsored over 400 EB5 investors. And of the 400, over 180 have received their conditional green card. Over 70 have received their permanent green card. And none of our investors have not been approved. Unfortunately, we, like so many others, other projects, we have investors that have filed several years ago and are still waiting. It's a very unfortunate situation, but there's nothing we can do about that. And we're excited to launch this project. As Carl mentioned, our previous investors have already received expedited processing, have been granted expedited processing, I should say. And and we have no reason to expect why future investors would not be granted the same. So, anything else?
Thank you, Steve. So, Dr. Johnson, maybe if I could hand over to you. I've done the introductions already, but if you wouldn't mind, maybe just giving us a little background into, well, why you acquired this hospital. You've invested very heavily in it. What do you see in this opportunity? Maybe a little bit of background on yourself as well would be very helpful.
Yes, I'm Dr. John Johnson. I'm a psychiatrist, practicing in the US, for over 25 years. And business of healthcare, is one of the major interests that I have. So whenever I see opportunities in areas where I can make a difference to people's life and also make a profitable, business venture, that was what attracted me. So behavioral health is a growing national problem, mental health and substance abuse issues, and also, primary care access in the rural areas. I had, converted a closed hospital in the past 10 years ago, which was purely a behavioral health 110-bed hospital as well as outpatient clinic. So I was looking for a general hospital, and East Ohio Regional Hospital, came as a potential availability. It was in Ohio. It was an existing hospital for 114 years before it closed in 2019 due to a few bad practices and all that. So I looked this as an opportunity to make a difference, because even when this hospital was operating, it was a medically underserved area. And I knew that the whole valley had significant shortage of mental health and addiction services. So this, is a 330,000 square foot building that needed a lot of infrastructure upgrades, equipments, and all the other stuff. So because I believed strongly in the project, I did buy that and did massive upgrades on the building, as well as the labs and imaging centers and ORs, to bring it to speed. So finally we opened last year, 2021. The turnaround strategy also is dependent upon the behavioral health and addiction services to use the excess capacity that was not being utilized in the past. We hired, in the middle of pandemic, we were able to open it, hired, more than 500 direct healthcare staff. We have put together a very, strong team. I wanted to introduce and hand over, to Bernie Albertini, who's the Chief Operating Officer, and to introduce the team and give a little bit more extensive background on, this hospital and its locations and its advantage, and, why it should succeed when the previous operations failed. Bernie, all yours.
Okay, thanks, Dr. Johnson. So my name is Bernie Albertini. So a pharmacist by education. I've been in hospital administration 20 plus years. Actually was the administrator of this hospital prior to it closing. However, I left before it closed due to the previous operator when they purchased the hospital. And I'll get into that here in a minute. So like Dr. Johnson and everybody said, we're located in Martins Ferry, Ohio, which is directly across the river from Wheeling, West Virginia. If you're familiar with this region, it's the upper Ohio Valley. We are medically underserved. And when this hospital closed and its sister hospital, Ohio Valley Medical Center, closed, they were both had been in the community for over 100 years. And this resulted in 400 beds being pulled out of the community, which left the community severely underbedded. There were 8 to 10 hour wait times at the other local hospital in their emergency room. So definitely a need to open up this hospital. I think part of probably what everyone asks me is, why is this different? Why will this hospital be successful when it failed before? So I just kind of need to talk about for a minute. Both these hospitals were purchased by Electo Healthcare out of California. They were very, Electo wanted more of a stake in this area. They already had a hospital in Fairmont, West Virginia, which is about an hour and a half south of where we are now. And they were in expansion mode. When they purchased the hospitals, they made a couple of strategic mistakes. One is they took on over $50 million in trade debt, which they were unable to recover from. And then secondly, being from California, they didn't really understand the market they were getting into. So with that, they expanded into a region they didn't understand, and so they failed and subsequently closed the hospitals in 2019. So what are we doing different? And we'll kind of talk a little bit about it in a minute. But we basically have come back on board with our core services, ER, surgery, inpatient unit. But behavioral health is a big piece. When OVMC closed in Wheeling, it was the only behavioral health hospital in the area. And so behavioral health scattered, whether it's Columbus, people are driving 4 or 5 hours for behavioral health care. So it's a huge opportunity for us to bring behavioral health back to the area. It's a much needed service. And I think it's the key to our success. Just a couple of things. Ohio has the 3rd highest overdose rate. West Virginia has the dubious honor of being #1 in overdose deaths. And less than half of the adults with mental illness in these areas get any kind of treatment. And what we've seen also with the pandemic, with the COVID pandemic, is behavioral health, mental health services are in high need. And it's just a good opportunity for us as a business opportunity, as well as taking care of our community. So just a great opportunity for us to move forward and to meet a totally unmet need in the community. So if you can hit the next slide for me, Carl, thank you. So again, our milestones, we opened in February 2021 with the basics, the emergency room, medical surgical unit, we have telemetry, lab radiology. Soon to follow is our operating rooms. So we have 6 operating rooms. We have 2 GI suites. Operating rooms are the newest in the area. So they were built as an add-on to the hospital in 2011. We have a accredited sleep lab. We have cardiac and pulmonary rehab. We opened a retail pharmacy. And then we have a multidisciplinary physician group. We have surgeons, OBGYNs, primary care. So it's a really good group of physicians that are kind of our core to our facility. A couple of things we did different. We used to outsource the laundry to a company in Pittsburgh, Pennsylvania, about an hour away. For the cost that we were paying the outsourced laundry, we were able, with less than a year's return on investment, to put in a commercial laundry. So we put in a commercial laundry complete with its own infection control, boilers, et cetera. The previous operator, Electo, had outsourced the laboratory for some reason. I'm not sure why, but we were bringing that back in-house. And that's added $1 million to the bottom line of the hospital. And additionally, they outsourced all the ER physicians, the hospitalist physicians. We now employ them, so we're not paying fees there, as well as the billing service was outsourced. So we're able to keep all those expenses in-house, but it also, the revenue offsets the expense and then some. Some clinical efficiencies. We opened a retail pharmacy on site. It's been wildly successful. We have a robust med-to-bed program. So when someone's getting discharged, people will go home without their meds. They don't stop at the pharmacy. They end up coming back in for readmission, and with Medicare, you don't get paid for that. So we're actually able to get people out the door very well with their meds. Investments, after the hospital had closed, when we came back in, it took us about 9 months after Dr. Johnson acquired the hospital to get it open, but there was no radiology, no lab equipment. So we actually have a full suite of radiology, MRI, CAT scan, general rad, lab. We have a state-of-the-art laboratory here, the best in the area. We also recently got an orthopedic robot. So we're the only hospital in the area doing orthopedic robotic surgery, as well as we now have a Da Vinci robot. That's enabled us to recruit some physicians away from our competitor who are having trouble getting time at their ORs at Wheeling Hospital, which is now owned by WVU. And I just want to touch on that just for a second. WVU took over Wheeling Hospital about a year ago. The community did not embrace it, as it saw the university kind of infringing upon the local area, and some of the local physicians have been very put off. And we've actually got a physician in our OR today who was a Wheeling Hospital loyalist who's come over and is now doing surgery with us. So it's been a good thing for us. You know, we've capitalized on it. You know, I always tell Dr. Johnson, you know, we're small enough. We're like a little dinghy, not a dinghy, but a little attack craft out in the water, and we're fighting up the aircraft carrier, can't make sharp turns. We make decisions quickly, and we're able to implement change very quickly to benefit the organization. So if you want to hit the next slide for me, please. Thank you. So kind of the timeline of what took place. So the hospital was acquired in the first quarter of 2021. Literally light swinging from the ceiling when we took over. The previous administration had not, for example, they didn't treat the water in the boilers, so the boilers were shot. The chiller, there was no air conditioning, so the chiller. So massive renovation and upgrades all through 2020. We were able to open in February of 2021. This year, 2022, you know, we've got a cath lab coming on board. We actually have started an 18-bed detox unit up on our 3rd floor. So we're doing acute medical detox. Later in 2022, we're going to have a 30-day behavioral health residential program. So we can have that up and running hopefully in the next 45 days or so. And then 2023, we're looking for a true behavioral health unit, hopefully to start probably a year or so, second quarter of 2023. That's construction, I'm sorry. And then the construction complete in 2024. So as you can imagine, behavioral health on the acute side, ligature proof or ligature resistant as you can get it, the best you can do to keep people from hurting themselves. It's very comprehensive. It's very complex, and the regulatory restrictions on that are large. So a lot of surveys and a lot of operational things to come across. So source of the funds on this, the EB5 capital, direct EB5 capital, 7 million. Developer equity was 9.6 million. ODH, so we had a Ohio Department of Developmental Services. We have a $10 million loan from them. And then the EB capital that we're trying to raise here would be 32 million. So all in all, you know, one of the big things is job creation. So we have created over there's 400 jobs required for 40 investors. We're way over what we need to do there. We've 531 direct jobs as well as 747 indirect jobs. So total jobs is over 1,200. So we are more than 3 times the required jobs to be met. We actually have a functioning hospital that's open. It's running. It's successful. So there's much less risk, if any risk of a failure not being able to get open. So that's kind of our project. It's a great story. You know, the community's behind us, the city's behind us, the patients have come back, the physicians have rallied around this, and you know, it's a kind of a Cinderella story that's gone on here, and it's just a really good story, and we really are meeting the needs of the community from a medical standpoint. And we think the behavioral health, you know, that was a new business line for us now because we didn't have behavioral health at this hospital in the past. We think that'll just totally, you know, set us over the top. So that's the 15-second summary of our hospital.
Excellent, excellent. Thank you, Bernie. So maybe we can open to questions, and sure. I will, let me just see if I've got an initial question here. Sort of, what if we don't raise the full amount of money? What happens to the behavioral center? And maybe, I don't know, Dr. Johnson, do you want to address that?
Yes, I'll address that. You know, so I believe in the project that, you know, even before the EB5 came in, or even before the state funds came in, you know, I invested over my own $15 million into that project. So even if the EB5 doesn't come, you know, that behavioral health unit will come on board and continue and provide the services that is needed in the community. But I don't, yeah.
Yeah, and maybe a question as well for you, Bernie, then also just on the competitive landscape. I think you've addressed this a little bit, but you want to expand on that a little bit?
Yeah, so I mean, the old, you know, we had the two hospitals that were in our system, East Ohio Regional Hospital, OVMC. OVMC had a couple hundred beds. East Ohio had, you know, 140 plus a 40 beds skilled nursing unit, which we have presently. Like I said, Wheeling Hospital was run by the Wheeling Charleston Diocese for years and years. They actually got into some trouble with the OIG and actually outsourced the management, and then eventually sold the hospital to West Virginia University. And I never want to bash our competitor. I certainly respect them, and we work well with them, but they have the university mentality. And the university mentality is, you know, if they have a general surgeon and they're not happy with them and they don't work for them, they don't want to sell to them, they'll bring people up from the university to do surgery and kind of put the local independents out. So like the guy I have here today has a very busy OBGYN practice, and he basically lost time. You know, he uses the Da Vinci robot, and he had 2 days of surgery, block time at Wheeling Hospital, and they took one of his days away. And so he said, well, fine, I'll just take everything to East Ohio. So he comes over here now, and it's just kind of a general trend of, you know, between the wait times, which frankly was not their fault when these two hospitals closed, but the, you know, the reputation and the perceptions out there, and unfortunately perceptions reality. So you know, it's a long wait time. You know, their quality scores aren't the greatest. I believe they're a 1-star Medicaid one, or Medicare 1-star star rating for the hospital. So, you know, we think we can, you know, we don't have a star rating yet because we just opened, but based on our numbers, we should be a 3 or 4-star. So, you know, we're hanging our hat on quality and being able to take care of people quickly and better than they do. You know, somebody asked me, how are you going to compete with a university-owned hospital? And I said, well, we're not. We're going to beat them, and we're going to beat them on quality and patient service. So, you know, these days patients are informed consumers. So we are just going out and we're putting a better product out there for them.
Excellent. Thanks, Benny. I have a question for Robert. From an immigration attorney. He has a client, Robert, that is Chinese national. Can he do a concurrent filing with investing in a TEA project?
Yes. Right now, the visa bulletin of the State Department says that there is no cutoff date for anyone from any country who is investing in a TEA under the new law, so after March 15 of 2022. So an investor who files that I-526 and is here and is otherwise eligible for adjustment of status can also file for adjustment of status now from anywhere in the world.
Excellent. Another question for you, Robert. Do you believe USCIS might continue to release more updates for the EB-5 program?
Well, I certainly hope so.
Yeah, I think so. Yes, absolutely.
There's a lot they need to clarify, but at least they've gotten the forms up.
Yeah. Okay. Yes, it's definitely become a lot more clear since the RIA came into effect. That, I mean, with yesterday's release of the form, certainly, I would imagine.
The process has become more clear. There are some things that could be clearer for parties who are trying to put together projects and make offerings. I mean, we know enough to be conservative. It'd be nice to have some clarity so we can, you know, maybe avoid doing quite so many things that we might not need to be doing.
Okay, thank you. Just a question here that I can answer. The question is whether existing investors that filed prior to March 22, do they fall under the direct EB-5 program or the regional center program? They filed under the pooled direct program, which is now no longer available. And then we had two questions here on what is the exit plan for this particular regional center. Who would like to take that one?
Steve, you want to go?
Steve, do you want to maybe answer the?
Sure, you bet. So the investors will receive a return on investment for 5.5 years. And after 5.5 years, the money is to be repaid by the hospital If it's not, then the return on investment jumps very dramatically. And I think we should have investors reach out to you directly, Carl, for the specific details on that.
Okay. Okay, just scrolling through some of the questions we've already answered. Yeah, a lot of the information will be available in the offering documents, which I suspect should be available later this week, hopefully. So all the details on the actual preferred rate and so on will be available in there. There'll be projected financials as well. So plenty of information in there. Maybe just one aspect of this investment that is also a little unique, and maybe a question for Robert, is that bridge financing, the EB5 capital is replacing bridge financing. Maybe if you wouldn't mind, Robert, explaining that, you know, how this works in EB5 in terms of job creation. You can,
Okay.
Yeah.
So USCIS has a policy written in their policy manual that says that if EB5, that it says that EB5 capital can be used to replace temporary bridge financing, either equity or loan, that has been provided and used in qualifying job creating expenses in the project. So by replacing that money that was properly spent, EB5 capital, and thus the EB5 investor of that capital, can receive credit for the job creation from that and all the other money in the project.
Excellent, thank you. Okay, well, I'm sort of cognizant of keeping this to 50 minutes or so. So I think there are some questions here that I can respond to as well afterwards. But I think those are sort of, I think we've addressed most of the questions that I think are worth addressing now.
Okay, Carol, I need to say one thing I
Yeah.
didn't say in my earlier when you were giving disclaimers, but as a lawyer, I'm here to talk about the law, and I'm not, I don't recommend or promote any particular project, even a project of a fantastic client. You know, just need to make that clear.
Absolutely, absolutely. Great. Well, thank you, Robert. It's been fantastic having you on this and hearing your insights. And you know, if anyone has any particular questions, we can address those to you, or and having the rest of the team here as well. Thank you very much for joining us, and we'll end off on that note.
Great. Thanks a lot.
Thank you.
Thanks,
See you.
everyone.
Thank you.